Hello, sir.
Hi Abhishek, how are you?
I'm fine, sir. How are you?
Good to see you. I'm great.
Yeah. Same here, sir. So happy to see you.
Yeah. So friends, today we have Dr. Abhishek Joshi with us live on this conversation. And Abhishek doesn't need much introduction. Most people who are active on Instagram, they do know about him. And in general also, everybody in homeopathy knows about uh, the prodigy that he is. And especially the time he has spent with Dr. Farokh Master, the legend. And I believe, Abhishek, you have recently penned a book about your
Sir,
experience.
it is in the last leg of coming out. We just on Sunday I released the cover of the book. The book is actually about my time with Dr. Master that I spent. It's 12 years. So there is a student when he spends so much time with a with his teacher, because we have a habit of writing all the notes since all the time. So I said, then why not just bring out all the notes, and maybe these notes can reach out to the people who never had the chance to learn from him, because this is an actual student edition. So there is a teacher edition and there is a student edition. I feel that when a real teacher comes in the flow, then he starts teaching. And I have really have had a fortunate time to travel with him in India, like in the state, in India and abroad. And he used to sit and he used to teach me. So the book is in the last leg, and I'm sure it should come out in 2 to 3 months.
So do send me a student copy of that because I have never had the good fortune of learning from him.
Sure, sir, sure. It'll be an honor for me that I will be able to send it to you.
Yeah, I really look forward to your first book.
Thank you so much, sir. Thank you.
And I actually look forward to many, many more books from you. The kind
S-
of knowledge you have and the kind of work that you have put in for homeopathy over the last decade, it's commendable.
So that's why the book's name is Dedicated Decade, because it's a series. If all goes well, because see, the publication house looks after all. Ultimately, they have to look after the economic part. So if there is enough support, if there is enough support from everybody, and if it gets sold, maybe the part two and part three. So it's I have written it as a trilogy, but let's see how how much things go well.
Look, if your guru is with you and God is with you, then everything else will fall in
That's
place.
true. That's true, sir. I totally agree with you. I totally agree with you. And I'm
Yeah.
really honored, sir, that I am a part of this Remedy Roundtable, where you have such great teachers. You yourself, Dr. Rajan Shankaran, Jeremy Sher, sir, everybody's, it's such a huge name. These are all legends in homeopathy. And I am on that panel that itself. Uh, I'm really honored to be here. And I want to give out my best, whatever I've learned, to share with everybody who is going to come to this Remedy Roundtable.
You are a very deserving addition to that Remedy Roundtable 2025. Please be assured of that. So,
Thank you, sir.
I believe, Abhishek, you were in Lucknow today,
On a weekend, on Friday, Saturday, Sunday, 3 days I was in Lucknow.
and I saw some pictures from that you shared some cancer cases there, I believe.
Yes, sir. So I also, since my days when I was passing out during my since my internship days, I have this great uh, thing towards cancer, that I want to learn cancer. I want to treat. I want to try and help out to people to how we can help. So this was fortunately a case of stage 3B serous ovarian carcinoma, and I could help this patient. I started treating this patient with the thing that let me try and help him as much as possible. And in this journey of 2.5 years with this patient, where the patient was being treated or was considered as stage 3B from Tata Memorial, and ultimately with homeopathy, today's patients, all the markers are normal, and patient is doing absolutely well. She's absolutely healthy, and we are still continuing the treatment. So I presented that case in Lucknow, and it was very well appreciated from a lot of senior homeopaths.
Great. I just saw that Dr. Jitesh Sharma has also joined in.
Yeah.
Hi, Jitesh.
Yes. Hi, Jitesh bhai.
So, yes, so I know that you have been treating cancer cases, and in the Remedy Roundtable also, you are going to present one of the cancer remedies,
Yeah,
carcinosin, I
yeah,
believe.
yeah, sir. Yeah,
So,
sir.
so tell me what have been your experiences with this remedy in brief?
So, obviously, when the first impression about carcinosin to everybody who starts reading carcinosin is that it's a cancer remedy. But I feel when I started learning, when I started reading, when I started prescribing, and started having experience of this remedy, it is, I feel this, it is a remedy of this era where we in this 21st century, or let's see where we are with these Gen Z community everywhere around us. So the kind of sensitivity which they hold in them, I think carcinosin matches up to a lot of situations around us. And when we are reading carcinosin, when we are reading cancer myism from Shankaran sir's sources, and I feel that this it's a whole journey that comes up in front of us when we read it in a very organized way. So that's what I'm going to put it forward to all our uh, audiences, that how this whole journey and how you can connect with this remedy when you connect with the patient, and the sensitivity of this patient changes a lot, and maybe cancer or maybe any pathological or psychological condition that you're addressing, it wonderfully gets treated by this.
Absolutely agree. So carcinosin is a remedy that has become a polychrist now.
Yeah, yeah, yeah. It's a polychrist.
And I really look forward to learning more about your experiences with this remedy
Yeah,
in Remedy
yes.
Roundtable 2025. And friends, if you have not registered for Remedy Roundtable 2025, go ahead and register for this wonderful course, very economical, where you will be able to learn from Dr. Abhishek about his experiences with carcinosin. And there are a lineup of wonderful teachers, right from Rajan Sankran to Jeremy Sher to Peter Zacharias. I'll be there. The Joshis, not Abhishek Joshi, but yeah. So the Joshis will be
The
there, and
Joshis will have majority on round table, sir. We'll have a majority on round table.
yeah, absolutely three Joshis. And Dinesh Chauhan will be there. Dr. Bipin Jain is going to be there. So it's going to be a wonderful get
Yeah.
together of some of the leading minds, and you'll be able to see how we study Materia Medica and what we can bring to the table, to this round table, uh, and give different facets of the remedies, that some of the remedies that you know, and many remedies that you do not know. So do join in that course. And apart from the course, Abhishek, Dr. Farokh Master is a master of Materia Medica.
Master of Materia Medica.
What have been your experiences of learning with him, especially the Materia Medica part? He's a master of therapeutics also.
Yeah, yeah, yeah.
Yeah,
So,
but
so
especially Materia Medica.
there is lot of practical approach more than we see that there are a lot of times when so I'll share just one line which he taught me, that he said, Abhishek, if you read Lycopodium from, let's say, 5 or 10 books, that is one Materia Medica. But if you treat 10 patients with lycopodium, you take out all those 10 cases and then form a totality. That is the best source of reading Materia Medica. Because there is one Materia Medica which is always in the books, and one which is always with the patients when you are practicing in your chamber, in your clinic, when you're seeing all the results in the patients. You can evaluate that what are the other things that lycopodium will have. So this one thing which we took it very seriously, that whenever we treat a case, whenever we are treating a case, we try to look at lot of different levels which he has taught us. There are various ways in which the Materia Medica is read. Obviously, we all are well versed with it, but the most important part is this clinical part, which and clinical part and the small finer observations which he comes up with because of his vast practice. He has taught us all these small finer observations, like how the patient sits, how he's answering to your questions, what is his body language, and these small observations when they come up the on the prescription table with you, I think that really matters a lot, and that is what will we will try to bring in carcinosin also. That what are these finer changes that we have to observe. A lot of time patients don't say a lot of, and you, as you already know, that Dr. Master has been a prescriber of advanced pathologies, and there is no hospital, no ICU in, I should say, India, where he has not visited a patient, he has not taken care of the patient in the ICU. So, from taking from multi-organ failure to septicemias to cancer, you name it, and I have been very fortunate to visit, to see, and to see that clinical observations, that when even when the patients can't say, even when the patient can't speak, how he has taught us that how easily I can put in 10 to 12 rubrics on the chart immediately, just by looking at the patient I can do that. So this is what he has come up with since so many years, that how we have to be so accustomed.
Yeah, I absolutely agree. The best way to learn Materia Medica is definitely through the cases,
Yes,
by
through the
seeing the
cases.
patients and learning from them. But in general, how do you study Materia Medica? What is your approach to Materia?
So it's a completely random approach. I don't have any fixed formula. I'll be very honest that uh, one thing which with Materia Medica, when it goes, that whenever we sit to study, the first thing that we actually want to bind everything to is Kent Materia Medica. That we hold it as our ground, where where we will add Allen's keynote, where we'll add Borik's Materia Medica, where we'll add Dr. N.M. Chaudhary's clinical observations. But the base has to be very strong, and I feel that that is what really helps you to build a strong totality of a case, like of a remedy in your head. The understanding goes really strong once the Kent Materia Medica is on your base.
But then how would you study a new drug?
So new drug will obviously come up with the new drug has to come up from a very strong source and has to be confirmed in your practice. If there is a new drug that is coming up, obviously I will not directly, I will try to learn from, first of all, if somebody has introduced a new drug to me, I will try to first learn from them itself, that what they are looking in that drug, how they are practicing in front of them, what are their observations, and are those observations replicable in my practice. And if I am practicing on the same principles, am I able to reproduce the same results? And if I'm producing the same results, what are the other observations in the same case that I can bring up to? And maybe that culmination can bring up a better Materia Medica for that drug.
Yes, great insights. And the one last question to you today: what are your favorite books? Like, what
Yes.
Medica books do you keep on your table?
Sir, I recently have had since few years, I'm strongly connected to a lot of Calcutta teachers. And out of them, one teacher is Dr. Naveen Singh sir. From him, I'm regularly learning, and we discuss a lot. And it's the same thing which I told you, that he says that Kent Materia Medica rakho. First is Kent Materia Medica, then is Allen's, Boric, N.M. Chaudhary. These, if these books, and especially with single remedy rubrics of Kent repertory. Even reading those single remedy rubrics, which I also discuss with a lot of my colleagues and students, that if you read a repertory, even that can help you to understand a lot of drugs very importantly.
That's also a wonderful way to learn Materia Medica, to construct Materia Medica picture through the repertory.
Yes.
Yes, that's a wonderful way, and you have learned well from the teachers, and we really look forward to learning from you. So, friends, if you would like to learn from Dr.
I
Abhishek
hope
Joshi,
I can I'll be able to reach out to you
I'm sure people are going to benefit a lot from your lecture. Uh, and friends, if you would like to listen to Abhishek Joshi and the other stalwarts
Yes, sir.
in the
Please.
Remedy Roundtable 2025, go ahead, go to
Yeah, 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 yeah.
www.hpathy.org and sign up for this course as soon as possible. Remember, it's hpathy.org. So, Abhishek, thank you so much for your time for this Insta Live today. And
Thank you so much, sir, for having me there. Thank you
I
so
look
much.
forward to connecting with you on the
Yes,
Remedy Round.
looking forward to learning. Let us all come together and learn, and let us make this Remedy Roundtable a huge success.
Thank you so much, Abhishek. Thank you so much.
Take care, sir. Good night,
Thank you,
sir.
everybody, for joining in and stay tuned on our Insta channel. Both ours and Abhishek's. There is a lot to learn, and we have to learn together and grow together.
Yes, sir.